healthmercy.org. This app will save millions of lives. Are you sick, but don't have money to consult a doctor or go to the hospital? Are you a doctor who wants to make a difference by volunteering just a few minutes a week to help patients online? Or are you a philanthropist, searching for a place where your money makes a direct, real impact, with no middlemen? With Health Mercy, you don't give money to any third party or to a patient. As a philanthropist, you communicate with the hospital and pay directly to the hospital for the patient's treatment. And you can communicate with both the doctor and the patient to see your impact firsthand. Join Health Mercy today. As a doctor, just 5 minutes of your time can save a life. As a philanthropist, just $5 can mean life or death for a child, a pregnant woman, or someone desperately sick. I have seen people die because they could not afford even $10 to visit a hospital. With Health Mercy, that story can change, because together, we can save lives. Every single day, thousands of people suffer and die. Not because their sickness cannot be treated, but because they cannot afford access to basic medical care. Over 13,000 children under 5 die every single day, most from causes that could have been prevented with simple treatment. And every 2 minutes, a woman dies from complications of pregnancy or childbirth, mostly in poorer countries. This is the reality we live in, but healthmercy.org is here to change that. How Health Mercy works. Healthmercy.org connects patients, volunteer doctors, and philanthropists in one simple platform. Here is how it works. As a patient, you register and create a consultation case describing your health challenges. Volunteer doctors with matching preferences are notified immediately. A doctor reviews your case and, if willing to help, assigns the case to themselves. The doctor then chats with you using our secure encrypted chat system. If needed, you can also have a video call. If the doctor sees that your situation requires tests or hospital treatment that costs money, the doctor will refer your case to philanthropists. Now here is the important part, clear and simple. Philanthropists do not send money to the patient. Philanthropists pay the hospital directly, the hospital that the doctor has recommended. This way, no cash goes into anyone's pocket. The money only pays for actual medical care. Inside the app, the philanthropist makes what we call a virtual financial commitment. This does not mean they pay money to the app. Instead, it's just a way to record in the app how much they have already paid to the hospital. For example, if the philanthropist pays $100 directly to the hospital, they will also indicate inside the app, "I have paid $100. This helps everyone see how much of the hospital bill has been covered. If the full hospital bill is $300, different philanthropists can each contribute. One pays $100, another pays $50, another pays $150, until the bill is fully covered. This works just like GoFundMe, but with one big difference: patients never receive money directly. All payments go straight to the hospital. And here is another important step for clarity. Once the hospital has treated the patient will confirm inside the app that they received treatment equal to the amount that the philanthropist indicated. This confirmation makes the process transparent and trustworthy for everyone. After treatment is complete, the doctor marks the case as closed. The philanthropist confirms the treatment was done. Finally, the patient gives a review, rating, and reward points to both the doctor and the philanthropist. These reward points accumulate over time. Bronze award at 100 points. Silver award at 300 points. Gold award at 500 points. Platinum award at 1,000 points. And Diamond award at 5,000 points. When a milestone is reached, we send an official award certificate to the doctor or philanthropist. This certificate recognizes their contribution to humanity, and it can be proudly used on a resume, professional profile, or social platforms. Customization and options. As a doctor or philanthropist, you have full control over which cases you want to help with. You can set your preferences, the types of illnesses you want to assist with, the age range, the gender, or even specific continents, countries, and states. This means you will only be notified about cases that match your exact interests. If a case is not suitable, you can decline it or mark it as invalid. And if you prefer, you can choose to be an anonymous donor. This way, no one will see your name or details, the crisis we solve. Why is this important? Because the crisis is real. In 2023 alone, 4.8 million children under the age of 5 died worldwide, mostly from preventable causes. Every year, around 260,000 women die due to pregnancy or childbirth complications. That is one woman every 2 minutes. In Nigeria, over 75,000 women died in 2023 alone, making it one of the countries with the highest maternal death rates in the world. And millions more die every year from chronic diseases, untreated infections, and conditions that could be managed if only proper medical care were accessible. healthmercy.org is designed to fight this crisis, connecting those who need help with those who are willing to give it. Call to action. So, what are you waiting for? Join now at healthmercy.org and be part of the movement saving lives. As a patient, you gain access to volunteer doctors and life-saving treatment. As a doctor, you use your skills to heal beyond borders. As a philanthropist, you make direct, transparent contributions that save real lives. Together, we can stop needless suffering. Together, we can rewrite the story of healthcare for millions of people. healthmercy.org, where patients, doctors, and philanthropists meet to make a difference. Be the reason someone lives today.